Hi and welcome to our telehealth safety information series. I'm Garvin and this video is on Plenvu. So what is Plenvu used for? Plenvu is a new type of medicine called bowel preparation. It makes your bowels clean so that you are ready for examination or surgery such as a colonoscopy. Plenvu works by emptying the contents of your bowels, so you should expect to have lots of watery bowel movements. Plenvu is a dual flavoured laxative with 2 doses contained in 3 sachets. There is 1 sachet for dose 1 and 2 sachets for dose 2. You need to take all 3 sachets for 1 complete treatment. Dose 1 is a mango flavour and dose 2 is fruit punch flavour, so they taste okay. Plenvu is intended for adults 18 years of age or older and including the elderly before any clinical procedure that needs a clean bowel. So ask your doctor or pharmacist if you have any questions about why this medicine has been recommended or prescribed for you. So when you must not take Plenvu. So if you are in poor health or have a serious medical condition, contact your doctor or pharmacist if you are concerned. And do not take Plenvu if you're allergic or hypersensitive to any of the ingredients of Plenvu or the binding agents. If you have a blockage in your bowel, so bowel obstruction, or if you have an opening in the wall of your stomach or bowel perforation, or if you experience problems with food and fluid emptying from your stomach, or if you have paralysis of the gut, or if you suffer from phenylketonuria, or if your body is unable to produce enough glucose 6-phosphate dehydrogenase. Also don't take if you have severe inflammatory bowel disease like ulcerative colitis or Crohn's disease. And also don't take if you have severe dehydration. Also, if you are not sure whether you should start taking this medicine, seek medical advice immediately and before you start to take it. So what should you do? To maintain good health, you should hydrate adequately before the use of any bowel preparation. If you develop significant vomiting or signs of fluid loss, like dehydration, tell your doctor immediately. Tell your doctor or pharmacist before taking Plenvu if any of the points apply to you. So first one is if you have an allergy to the ingredients, if you have any heart problems and heart rhythm problems or kidney problems, if you have any problems swallowing, or if you have a high or low blood salt level, if you have diabetes or any other medical condition. So tell your doctor if you are pregnant or plan to become pregnant. Your doctor can discuss with you the risks and benefits involved in taking Plenvu. Tell your doctor if you are breastfeeding. It is not known if Plenvu passes into breast milk. So you and your doctor should decide if you will take Plenvu while breastfeeding. So while taking other medicines with Plenvu, tell your doctor or pharmacist if you have recently taken or might take oral contraceptives, diuretics, calcium channel blockers and steroids, as well as any you get without a prescription from a pharmacy. So medicines taken by mouth may not be properly absorbed when taken within 1 hour before the start of Plenvu. So your doctor or pharmacist have more information on which medicines to be careful with or avoid while taking this medicine. Plenvu with food or drink. So what do you take Plenvu with? So continue to drink clear fluids before, during and after you take Plenvu to help prevent fluid loss or dehydration. It is important for you to drink the additional recommended amounts of clear fluids. So examples of clear fluids are obviously water, clear soups, herbal tea, black tea or coffee without milk, soft drinks, diluted cordials and clear fruit juices. So when taking Plenvu, you should continue to take plenty of clear fluids. The fluid content of Plenvu does not replace your regular fluid intake. So the 2-day split dosing schedule and the day before dosing schedule. So what do you do? So on the day before the clinical procedure, you can eat a light breakfast followed by a light lunch and must finish eating this meal at least 3 hours before you start taking Plenvu, after which you may consume only clear fluids. So the morning of the dosing schedule, on the day before the clinical procedure, you can eat, as I said, a light breakfast, followed by the light lunch. And plain yogurt for dinner, which should be completed by approximately 8 p.m. You may only consume clear fluids after the dinner on the evening before the clinical procedure. No breakfast is allowed on the morning of the clinical procedure. Your doctor may give you additional dietary advice which you should follow. So how to take Plenvu? So your doctor may prescribe the 2-day split dosing schedule, the morning only dosing schedule or the day before dosing schedule, depending on the scheduling of your clinical procedure. Before you take Plenvu, so you read carefully the instructions. You need to know before you open the box and start mixing the sachets. Make sure you know when to take Plenvu, how to prepare Plenvu, how to drink the Plenvu, and what you should expect to happen, such as loose movement or bowel movements. So next is when to take Plenvu. Your treatment with Plenvu must be completed before your clinical procedure. This course of treatment may be taken as divided doses, as I already discussed. So the 2-day split dosing schedule, take 500 ml of dose 1 of Plenvu, followed by an additional 500 ml of clear fluid in the evening before the procedure at approximately 6 p.m. and 500 ml of dose 2 of Plenvu followed by 500 ml of clear fluid in the early morning of the procedure or 6 a.m. So the morning of dosing schedule, you take 500 ml of dose 1 of Plenvu followed by an additional 500 ml of clear fluid and 500 ml of dose 2 followed by another half litre of clear fluid in the morning of the day of the clinical procedure. The time between finishing the first dose and starting the second dose should be separated by a minimum of 1 hour of an interval. So the day before dosing schedule, you take a half litre of dose 1 and a half litre of dose 2 of Plenvu Sachets in the evening of the day before the clinical procedure. So the time between finishing the first dose and starting the second dose should be separated by, again, a minimum of 1 hour. Your doctor will tell you which dosing schedule to follow. Do not add any other ingredients to the doses. So how do you prepare Plenvu dose 1? You open the carton, remove dose 1 sachet. Pour the contents of dose 1 into a measuring container that holds 500 ml of fluid. Add water, not chilled water, to make up 500 ml and stir until the powder is dissolved. This may take up to 7 or 8 minutes. So how do you drink the Plenvu dose 1? Drink the 500 ml solution over 30 minutes. Try to drink a glass every 10 to 15 minutes and drink an additional half a litre of clear fluid over the next 30 minutes. So water, clear soup and cordials are all suitable. How to prepare Plenvu dose 2 sachets. So when you're ready to take dose 2, pour the contents of dose 2 sachet A and dose 2 sachet B into a measuring container that holds half a litre of fluid. Add water, again not chilled, to make up the half a litre and stir until all the powder is dissolved. This may take again 7 or 8 minutes. So then, how do you drink Plenvu Dose 2? At the time you were given, based on the recommended dosing schedule, you drink the 500 ml of dose 2 over 30 minutes. You drink an additional 500 ml of clear fluid over the next 30 minutes. In addition to Plenvu and the additional clear fluid, after each dose, you're encouraged to drink extra clear fluid as needed to avoid thirst and dehydration. Drinking clear fluids will help prevent fluid loss, so you must stop drinking all fluids at least 2 hours prior to your clinical procedure. So what you should expect to happen when you start taking the Plenvu solution, it is important that you stay close to a toilet. At some point, you will start to experience watery bowel movements. This is quite normal and indicates that the Plenvu solution is working. You may have stomach area bloating before you have your first bowel movement. If you follow these instructions as I outlined, your bowel will be clean, and this will help you to have a successful clinical procedure. You should allow sufficient time after your bowel movements have subsided to travel to the hospital. After your procedure, you should maintain adequate fluid intake for good health. So the main side effects of Plenvu, you tell a doctor or pharmacist as soon as possible if you do not feel well while you're using Plenvu. All medicines can have unwanted side effects. Sometimes they are serious, but most of the times they're not. Do not be alarmed by the list of possible side effects. You may not experience any of them. So ask your doctor or pharmacist to answer any questions that you may have. It is normal to get diarrhea when you take Plenvu. If you do not have a bowel movement within 6 hours of taking Plenvu, stop the intake and contact your doctor immediately. As with other medicines, there is a small risk of a serious allergic reaction. Stop your intake and tell your doctor immediately, or go to the accident and emergency department of your nearest hospital if you notice any of the following side effects, as these may be symptoms of a severe allergic reaction. So extreme fatigue, palpitations, sudden or severe itching, skin rash and hives, shortness of breath and wheezing, swelling of your face, lips or tongue, and also ankles or other parts of the body. Tell your doctor immediately if you have any of these symptoms of a loss of too much body fluid while taking Plenvu. That can cause confusion, dizziness, excessive thirst, headache, urinating less often than normal, or dark coloured urine, vomiting as well. Also tell your doctor right away if you have severe stomach area or abdominal pain. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website, mytelehealth.info, or call to Lynch's Pharmacy, Douglas, Cork. Or you can ring us on 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.